So if I was going to set up for a composite filling, I'd set up a tray with a mirror, a probe. I like to put a liner on there in case the dentist needs to wipe the material off one of his instruments. An excavator, so what this does is it removes all the soft decay from the tooth before they have to drill, and the dentist can see how far down the decay is as well. Mirror for looking. If you do notice the mirrors are scratched, then change the mirror head. They do just twist off. That would go in the sharps bin, and then you can replace a new head. Then you've got a packer which packs the filling. It's got a small area and then it's got a large area as well. And then you've got a burnisher. So what this does is it smooths the filling in the tooth. And again, it's got a small and a large area. You've got a flat plastic, which the dentist uses quite a lot. So I'd always get out, if you're just doing a short tray, do a mirror, probe, flat plastic and the tweezers. So you'll always need tweezers. And then you've got the Carver as well. So this is good for amalgam fillings. That carves off the amalgam filling. You won't really use this for a composite. You'd use the pointy bit of a flat plastic. You can use that as a carver. So I would put a couple of cotton wool rolls on the patient's tray. So that's ready prepared for the dentist as well. And I've got the hand pieces. Okay, I would get the etch ready with a new applicator. What the dentist does is it acts as an acid on the tooth. So when you prepare the tooth with the fast handpiece, he then puts the acid on the tooth and then he washes it off with a 3-in-1 tip before applying the bond. So he'd have to put his cotton wool rolls in at that stage to make sure that it's nice and dry. With the bond, you can either, some dentists like a little drop on the back of the hand. If you're going to do that, you shouldn't be touching the dentist's gloves. I prefer it on a pad. I've not got one at hand right now, so just put a little bit on a pad and you'd pass that to the dentist under the patient's chin. When it's time to get the composite out, after that's been light cured, you'd get a small bit at a time. Again, you'd put it on the pad and then pass that pad to the dentist. Use a little bit each time and then keep the lid on. So once the filling is set and it's light cured, the dentist will use the fast handpiece, and there's a selection of burrs in there which you can use. I always get the burrs ready because I know he'd use this one for stoning. And then I always use the Softlex disc as well. So I've got a couple of discs there what you can use. So all you do is push the disc on. Have a feel on this because the smooth end, it depends what he's doing because this is the rough end. So if he's doing the top of a tooth, you'd need it that way up. If he's doing under the tooth, you can turn it around. So that goes into the slow hand piece. So you turn the catch out the back, put it in and then make sure that's secure. I'd also get floss as well because with a white filling you don't know whether it's gone in between the teeth. So if the composite filling has gone a little bit over, we'd be able to tell when we floss it. If that floss didn't go down, then you'd need to get a handpiece and remove the rest of the composite. Once that stage is done, we get the patient to bite on articulating paper. So there is something called Miller's Forceps. I'll just use tweezers for now, which holds the end of the articulating paper. You'd put that in, get the patient to bite down and then move their teeth round and round. And any areas which show, this side is blue by the way, any areas which show blue, they're the high spots. So then that's what he'd use either his Softlex disc on or he'd use this in the handpiece. If it's a composite filling on the anterior teeth on the front, he might use a strip. So again, it's a Softlex disc in the strip form. So we'd use that in between the teeth. Before we did the filling, there's a clear matrix strip. So you'd get 2 centimetres or more. I'll just use a little bit now just for the purpose of the video. And then he'd put that in between the teeth whilst he built up the composite so it doesn't stick to the tooth next door. So if it is a front filling, always get this out on the side. It's important to get everything out at the beginning so you're not going in and out the drawers throughout. Even if you end up having to put something back, it's better to do that.